Well, hi friends, and welcome back. I'm Dr. Vicencio, a board-certified endocrinologist. I post videos of common questions I get in clinic, and one of the issues I see all the time is vitamin D deficiency and occasionally vitamin D toxicity, and also just in general people asking about should they be on a vitamin D supplement, and if so, how much. There are some pretty bizarre vitamin D regimens people are taking out there, which can be dangerous and cause serious problems if you don't know what you're doing. So we'll get into all of that in this video, so stay tuned. First of all, the term vitamin D is a misnomer because it's not a real or true vitamin. It's a hormone. The definition of vitamin is a substance that is essential for the normal functioning of the body and cannot be synthesized by the body, but that occurs naturally in foods. However, vitamin D is not a true vitamin because nutritional supplementation is actually not required in humans who are getting adequate sun exposure. A hormone, on the other hand, is a chemical produced by the body, which we do, that exerts a biological action on a target cell, which vitamin D does. When our skin is exposed to ultraviolet irradiation, a precursor of vitamin D called 7-dehydrocholesterol in our skin is converted to vitamin D3. So we don't actually get vitamin D from the sun. The precursor is already in our skin, and the action of the sun's rays convert it to vitamin D. However, as a society, we've become more and more aware of the risks of solar irradiation and skin cancer. And so the use of SPF sunblock has resulted in increased reliance on dietary sources of vitamin D. The major dietary sources of vitamin D include fortified dairy products, egg yolks, fish such as rainbow trout, salmon, sardines, and tuna, liver and cod liver oil, and mushrooms. Vitamin D derived from plant sources is vitamin D2 or ergocalciferol, whereas that provided by animal sources is in the form of vitamin D3 or cholecalciferol. These two forms are equally potent, but there is some evidence that vitamin D3 may be a little more effective at increasing 25-hydroxy-vitamin D levels. Cholecalciferol and ergocalciferol are transported to the liver where they undergo 25-hydroxylation to make 25-hydroxy-vitamin D, which is the major circulating form of vitamin D in the body and the principal storage form of the vitamin. This is also the test your doctor will order to measure sufficiency of your vitamin D stores. 25-hydroxy-vitamin D then goes to the kidneys where the final step in production of the active form of vitamin D is made by 1-alpha-hydroxylation of 25-hydroxy-vitamin D to 1,25-dihydroxy-vitamin D, also called calcitriol. So what are the actions of this activated form of vitamin D or calcitriol? Well, number one, and probably most importantly, it increases dietary calcium and phosphate absorption from the gut. Second, it also facilitates calcium reabsorption in the kidneys. Third, it decreases production of PTH, or parathyroid hormone, from the parathyroid glands. And four, it also increases bone resorption and formation. So deficiency of vitamin D can lead to a condition called rickets in kids, which is a condition that causes bone deformities such as bowing of the legs, frontal bossing, whitening of the wrists, and soft skull bone deformities called craniotabes. In adults, it can lead to decreased bone mineralization called osteomalacia. It is also associated with proximal muscle weakness, dental defects, and low blood calcium levels and blood phosphate levels that result in secondary hyperparathyroidism. However, too much vitamin D can be a serious problem too and can lead to calcification of the soft tissues, deposition of calcium and phosphate in the kidneys, which can lead to formation of kidney stones, and dangerously high abnormal blood levels of calcium that can cause cardiac arrhythmias or irregular heart rhythms. Because vitamin D is a fat-soluble vitamin, that means that it's stored in fat tissue. So high levels of vitamin D can result in severe and prolonged high calcium levels. The blood level of 25-hydroxy-vitamin D that defines vitamin D deficiency remains somewhat controversial. The Institute of Medicine has defined a vitamin D sufficiency level as that higher than 20 nanograms per milliliter. The Endocrine Society defines vitamin D deficiency as less than 20 nanograms per milliliter, insufficiency as 21 to 29 nanograms per milliliter, and sufficiency as above 30 nanograms per milliliter, up to as high as 100 nanograms per milliliter. There are some exceptions though, where you would actually want to target a lower level of vitamin D than 30. And that is in people who suffer from chronic granuloma forming disorders, including things like sarcoidosis, tuberculosis, and chronic fungal infections like histoplasmosis. And some people with lymphoma should also target a slightly lower vitamin D, somewhere between 20 and 30 nanograms per milliliter, in order to prevent blood and urine calcium levels from getting too high. So how much vitamin D should I be taking? Well, the Institute of Medicine recommended dietary allowance of vitamin D for adults between ages 19 and 70 is 600 international units per day and 800 international units daily for those over 70 years of age. However, they do acknowledge that some people may have greater requirements and set the tolerable upper limit of daily intake of vitamin D at 4,000 units per day. The National Osteoporosis Foundation and the North American Menopause Society recommend 800 to 1,000 international units per day of vitamin D3 for women aged 50 years and older. And the Endocrine Society recommends for all adults aged 50 to 70 and 70 plus years require at least 600 and 800 international units per day, respectively, of vitamin D. However, they also state that to raise the blood level of 25-hydroxyvitamin D above 30, this may require at least 1,500 to 2,000 international units per day of supplemental vitamin D. Very high doses of vitamin D are sometimes required to correct vitamin D deficiency. For example, one regimen that I use quite frequently when someone's vitamin D level is quite low is 50,000 units of ergocalciferol once a week for a course of, say, 8 to 12 weeks. However, after the desired level is reached, the dose should be reduced to a safe maintenance dose. And that's an error that I see pretty frequently in patients who are coming to me, sometimes from other folks, is that they are left on 50,000 units a weekly for 6, 12 months. It's just kind of gets forgotten about. And that sometimes can be dangerous because it can lead to high levels of vitamin D and high levels of calcium in the blood. Similar to the Institute of Medicine, the Endocrine Society suggests that the maximum daily maintenance dose of vitamin D for adults of 4,000 international units per day should not be exceeded without medical supervision. So please be wary. If you are on higher doses than 4,000 units per day without periodic monitoring of your levels, and your doctor hasn't asked you to be on these high doses for some other reason. For example, if you have a history of gastric bypass, you may have a very good reason for being on higher doses than 4,000 units per day. But if not, just take caution, because you may be putting yourself at risk for vitamin D toxicity. The bottom line is that the two main sources of vitamin D are, 1, through activation of vitamin D precursors in our skin from the sun, and 2, from our diet. For those who do not get a lot of sun, a daily supplement between 600 and 2,000 international units per day is safe and will be sufficient for most people. Maintenance doses higher than 4,000 international units daily should not be used without medical supervision. Well, that's all for me today. Thanks for tuning in. If this video was helpful, and if you want to hear more about this and other endocrine topics, click like and subscribe. I'm Dr. Guie Vicencio, helping you with all your hormone needs and to find your perfect balance. Until next time, hasta luego.